let me thank you and all the colleagues that helped you, and a special thanks to the Italian Cooperation Fund and support, and to the Italian Ministry of Foreign Affairs. I remember last summer I was at the Ministry of Foreign Affairs in Italy, and I met the Minister Gaudiano. His Excellency asked me directly about this project and about the advantages if we have this project done. And I was really very honest in telling him the needs, but also telling him the facts. We have many challenges. So I'm still there. We have many challenges to make this happen. That's why we need more commitment from your side and from our side. This message is to everyone. We need this to happen, and we need our commitment to make this happen. So thank you very much, and a special thanks also to His Excellency Mr. Carmelo Figara, for the General Counsel of Italian Erbil, for his continuous support, and I think that he will be also with us via Skype. So really special thanks from the Director General of Health in The Hague to His Excellency for his continuous follow-up and support, not only for this project, but also to all other projects that Italian government is implemented here in The Hague.
Again, thanks and appreciation for Tor Vergata University in Roma, and also thanks for Erbil Consulate of Italy. Great thanks for our teams in the planning department. And also finally, I hope this conference successfully end and fruitfully. Thanks again. Welcome all of you.
It was much to start my speech with expression of our great thanks and appreciation for Italian government and people for their continuous support to our region in different sectors. Particularly in health sector, there are much to be mentioned. Dear colleagues, this bilateral project for developing a convenient health information system in Kurdistan will be a crucial and strong moving forward step to improve healthcare services and fasten reform program in healthcare system in Kurdistan, as well as now that reform and development of health system cannot be carried out without health information system. Depending on this fact, we did much to strengthen our health record and health information. We have planned to change health record from paper-based to electronic-based.
Today I would like to really thank the Kurdistan regional government, the Ministry of Health, and the Minister himself. I'm really happy and glad that you are here with us today. Because we are in a process of implementing a very important project for the region, and since, as you see, the title of the project starts with pilot, which means that we hope that it will develop in the future, not only in the 3 provinces of the Kurdistan region, but probably Iraq-wide. I would like to really thank you again, Your Excellency, for being here. Thank you, University of Tor Vergata, of course, Italian Cooperation, which I represent, but above all of you. Really, I'm surprised, not surprised, but it's a mix between surprise and glad to be people standing. It means that the attendance is very high, and that means that the interest for what we are doing is important. And I interpreted it as a sign of appreciation for what we are doing. Thank you very much again.
Thank you very much. Thank you very much for coming. And thank you to Dr. Miran, Dr. Leonardo, Dr. Dario. I'm glad to be here to represent my country, the Consulate of Italy, the Ministry of Foreign Affairs. And of course, thank you to the University of Tor Vergata, who has developed this program here, this pilot program, which will last for a long time. I really hope so, and I hope it will be useful as it was useful in other contexts.
With the help of a health monitoring system, in the moment in which we take the responsibility to treat or to take care of the health of our patients, with the help of a health monitoring system, we are at the same time also taking care of the health of the whole region, of the whole country.
So the goal of our health information system is to collect data day by day, patient by patient, so that we could become able to follow the health development throughout the time, comparing next year with this year, comparing after 5 years with today, but at the same time also to be able to compare the data at an international level, to compare Kurdish data with data in Italy or wherever. But obviously, in order to do this, Kurdistan and Italy have to speak the same language. Kurdish is not ideal to understand each other, but also English is not ideal to understand each other. Ideal is, when we are speaking about data, to have a coding which is internationally recognized, that everybody in every part of the world can recognize it. And this was our choice, to develop a system which collects data routinely, regularly, and at the same time with a system which speaks a language which is internationally understood.
I can manage the single event data, I can enter using my mobile phone, and I can manage view using my mobile phone, and I could also manage the statistics and the data report from the mobile phone. So we have a system running of an international server used by more than 40 countries, but this system is accessible by any computer, any laptop in the Kurdistan region, and this system permits also the access by the mobile devices.
But here is already one question.
Thanks, Professor. Really, I have many questions.
Thank you for this opportunity.
ICD-10 even includes in its classification a chapter about factors influencing health status. What does it mean that the ICD-10 even takes into account takes into account social factors.
This program is it play a crucial role in improving the quality of health system in Suleimani and KRG as general. My colleagues, today we will introduce the program to you, but the implementation depends directly on you and your support. We will start the program in the beginning, in the next year, in a few hospitals and primary health centers. Then if we succeeded, we plan to cover all the hospitals and all areas.
Good morning, ladies and gentlemen. Warm welcome to our guests, Dr. Sergio, Dr. Leonardo, Dr. Dario, and Dr. Faik from Erbil. بيانيتان باش دیارە من بەخێراتنی هەموو لایەکتان دەکەم و ئینشەڵڵا یەکێک لە هەرێ خاڵە بەهێزەکانی ئەم وەرکشۆپ و ئەم ترینینی ئەمڕۆ ئەوەیە کە زۆرینەی ئەو پزیشکانەی تایە کە لە فترێکی کەم ئینشەڵڵا بنە ئیخسایی و شاری سلێمانی ئەو کۆمەڵەی ئێرە بەڕێوەی دەبن لەگەڵ کۆمەڵێک مامۆستای خۆشمان کە لێرن. دیارە ئەم کۆنفرانسە لەسەر پلەبەندکردنی نێودەوڵەتیە بۆ نەخۆشیەکان واتە International Classification of Disease کە ئەمە دیارە پرۆگرامێکی نێودەوڵەتی کە پێی دەڵێن ICD-10 کە